My name is Victoria Ekpoma. I'm a Doctor of Nursing practice student here at the University of Utah College of Nursing. My specialty track is in organizational leadership. I am a certified nurse educator, a global health nursing instructor, and an immigrant to the United States. As an immigrant, I care deeply about the issues that affect immigrant communities around the world. And those include health disparities, socioeconomic inequities, and global health concerns. My research focus is on global women's health, sense of belonging and thriving, as well as a sense of global stewardship across institutions of practice and communities of impact. I hope that a global learning experience would provide an opportunity for an awareness of the social cultural challenges that immigrant communities face around the world. Personally, and based on my experiences in nursing school and just as a global citizen and just being a part of this world that we're in, global learning is an avenue or an opportunity for us to look at the issues and nuances that transcends across cultures and people, the things that bring us together and fosters a sense of interconnectedness towards our humanity. So global learning will be that pedagogical approach to understanding what it means to see a people, see them, see their challenges, and find a way to understand how to help them thrive. So it's going to be awareness of these people, understanding the skills needed to integrate and engage from a perspective of caring, and finding solutions to help them thrive. An understanding of global learning from an institutional perspective and a nursing education perspective affords us an opportunity to better equip our students with the culturally sensitive and congruent skills they need to engage and practice in this global community that we all exist in. If we look at our Utah community, for example, it's progressively getting more diverse. So if we equip our students with the skills needed to appropriately administer cultural sensitive, culturally responsive, and socially appropriate care to the populations that we currently have, then we can consider how we can maybe take those solutions and modify them to suit other culturally available spaces around our globe. So we come out from this micro perspective of learning where we're dealing with one type of population, and then we think about how we can better utilize our foundational nursing skills, kind of back them up, like power charge them to serve diverse communities and populations around the globe. So in order to reflect on the skills that we're able to acquire, say in the College of Nursing, that I have acquired in the College of Nursing, and how that translates to my practice in my community, it takes me back to how is the College of Nursing teaching me to recognize the needs of these communities. For example, when I create my curriculum for my nursing students, I make sure that they're aware that they have this perspective of the global clients or patients that are going to be present in the community that they're in. The College of Nursing equips me with the skills that I need as a nurse educator to then create those curricular structures within which those students can have that awareness and develop those skills to practice in the community. So when I take a student to an immigrant function or a cultural day at an immigrant community or cultural program, I am confident that they're able to interact with that community with cultural sensitive skills, with appropriate communication and language, because we think about communication and language like they're the same thing, but they're not. They're social and cultural cues that you don't get until you have interacted with these communities. And you can't get that in the classroom. You have to be boots on the ground with this community, interacting with them, building trust, showing that we as the College of Nursing and we as institutional spaces across Utah are places of safety, cultural safety, where these communities can interface and find solace for the problems and concerns that are prevalent in their communities. As an immigrant from Nigeria, I grew up in the urban city of Lagos. And when I had an opportunity to be a participant of a World Health Organization and USAID and the government of Nigeria sponsored initiative to have a group of medical students, health sciences, nursing students, and midwifery practitioners go into a rural community in Edo State, Nigeria, to care for that community, we were able to reside with them for a few months, learn their culture, learn their language, and the nuances of what it meant to be in that community. And that experience taught me the value for a change in perspective. I was an urban child or an urban brought up student experiencing a rural perspective. Because of this opportunity to see this perspective from the views of the people who lived in that community, I was able to better understand their needs, their challenges, and build collaborative solutions with members of that community to address the needs that they had. It was empowering for me as a student at that time to see the impact of the work that I was able to do in that little space. But it was also empowering for the community to know that we cared about their voices and their perspective, and we were not just coming to impose solutions on them, but seek their partnership in solving those problems. That experience guides my view, the research that I currently do today, the way I interact with local and global communities. It reminds me that these individuals are shared stakeholders in the problems that they face. And they are able, or better able, to find those solutions. All we need to do is listen better and be willing to work with them to achieve sustainable, culturally responsive, and adequate solutions to solve those problems that we find together. One of the most impactful global learning experiences I had was when I was back home in Nigeria. There was an initiative with the World Health Organization, USAID, and local hospitals, teaching hospitals precisely, and they were able to send nursing students, medical students, midwifery and health science majors to a rural community in Edo State. And in this experience, we were able to be with this community for a few weeks. I believe it was about 4 weeks at the time. We were able to care for this community. We identified specific needs of the members of the community, and in partnership with community leaders, community members, we're able to provide or build solutions to solve the unique problems that existed in this community. As I reflect on that experience, I see the undeniable, invaluable impact that it left in me, a child that grew up in an urban city. Urban needs are different from rural needs, and I was oblivious to the existence of unique rural problems. But it also made me realize that even the problems within that rural community was going to be different for the next rural community. It created an awakening for the realities of the interconnectedness, yet unique experiences of rural communities in this global world that we live in. That experience impacts my choice for the work that I do, the kind of research that I take on, the things that I care and pursue, how I continue to be an advocate, a voice, how I continue to redefine my role as a liaison or a broker for these communities that often have no voices in the spaces where their issues and their concerns are being addressed. I believe that my role as a nurse educator today, a member of a reputable institution of nursing and a global citizen, I have a unique platform because of that experience to represent their needs in a way that is respectful and responsive to the experiences that I had being in and with that community. In my experience, the benefits of local and international collaboration from a global perspective is invaluable. When I think about the communities that exist within spaces and silos that we consider global, the resources that they need to thrive are embedded or housed within these local and international institutions. How do we build a bridge or fill that gap so that resources can meet places of need? That is how, when we answer that question of gap, access, and a pipeline, we begin to address the issues of global suffering, global struggles, global challenges across local and international communities. I'll give you an example. The University of Utah has a new refugee program. There are people in the communities here in Utah who need the resources that are existing in that program. Unless they interface or find a way to connect with the University of Utah, they will have no access to that program. The only way that they can access or interface with the University of Utah is maybe if they come into a community clinic. Now, if the patient doesn't come to a community clinic, it means there's absolutely no way they can interact with that resource that they need. So it is the job of the University of Utah, this institution, to go out there and make the community aware of the resources that they have and how they can better tailor those resources to meet the needs of the community. We can't do that in the building. We can only do that out there. So this is why we need culturally responsive, congruent collaboration across communities. We're talking community stakeholders, individual members, local leaders, making their communities aware of the conversations that are happening within these institutions. And that way we can better connect individuals with the resources that they need. This is the value of local and international collaborative efforts for global health, global equity, and global sustainability. You see, global engagement across academic institutions is a core part of global learning. We can't talk about global learning without talking about the stakeholders involved in the education of the people who are going to care for these global communities. The academic institutions of learning herald the process, the curriculum, the pedagogy, how we use research, how we inform our knowledge, skills, and practice when we're engaged with this community. That is global engagement. That is the core foundational concept in global learning. So when I think about my classroom, I, as a Nigerian immigrant, a nurse educator in the United States, I have resources. I can leverage my background to reach out to educators, institutions of learning, healthcare organizations in Nigeria, in Ghana, in Ethiopia. I can integrate their students, their learning into my classroom through virtual classrooms, through projects, collaborative projects. We can look at the foundational needs of global communities in the classroom. We can build sustainable, culturally relevant solutions to these problems. heralding the knowledge and experiences of these student interaction, faculty interaction, and institutional collaboration. We see multiple levels of integration of global understanding, the global perspective, and rolling out global engagement initiatives that are going to succeed. So if we want to talk about the benefits of global learning, that's the core right there. That we can do this in the classroom here in Utah, we can do it in Ghana, Ethiopia, Russia, Siberia, wherever it is, the world becomes smaller and we become more effective in the things that we do as institutions of practice, also as professionals. So we can make this work, we can make this happen. And I hope that we're thinking about these things as we build our curriculum, as we take our students out, as we engage with our communities. We're asking those questions. How is this relevant for my classroom and classrooms around the globe? An example of a global learning experience that I am currently working on, which is part of a broader research initiative, is having instructors, nursing educators from different countries, the United States, myself, a friend in the United Kingdom, an instructor in Nigeria, one in Ethiopia, and one in Ghana, bringing our global health students together in one virtual classroom and building curriculum to empower these students to find the needs in their local communities and bring them into the classroom environment where we can use evidence-based global learning frameworks to solve those problems and build sustainable solutions for their local communities within these classrooms. So a part of this global learning experience will be answering the question, how do we as educators form the skills needed to identify the individual needs of these students? How do we also empower these students to solve the problems in their local communities and translate those solutions across communities across the globe? Now, how do we do that? Well, we as educators are uniquely poised to create that curriculum, to curate that learning experience for them that is not only meaningful for the local communities within which they exist, but create that responsiveness to a call to a global problem that needs to be solved. So now we're creating local champions, but global leaders in the classroom. This is the value of that kind of international and local collaborations to create the leaders, the people that are going to champion this work for a more equitable global environment, for a more equitable global future for ourselves and the generations that come after us. Let me share my vision for a truly transformational global learning program. It would be the establishment of an institution of learning that communities can look to these institutions as safe haven. Students can come into this institution and find out what research are currently available, what programs and projects they can seamlessly plug into and roll out as part of their educational experience across all levels of the education. So that includes pre-nursing, BSN, master's, PhD, postdoctoral level students. They can all find applicable global learning projects and initiatives that they can either build and lead themselves or be a part of. And they would have the skills, knowledge, and cultural competence to be a part of that work. So that would be my dream for a global learning program. And I appreciate the work that the University of Utah College of Nursing-led global learning program is currently doing. It has afforded me the opportunity to be here today to talk about this work, this initiative that I am so passionate about. And I see this going places because we're having these initial conversations, but conversations lead to awareness. Awareness leads to engagement, and engagement leads to sustainable solutions. So we're on the right track. And I hope that this conversation about global learning, global engagement, the global perspective can all be today the beginning of something beautiful for a more equitable global society here and around the world. My personal global learning experience has created within me a sense of pride for my uniqueness, my humanness. It has created a sense of humility in the space within which I exist and I'm able to have impact. My global learning experience have tailored the way I expend my academic currency. It drives my research. It drives my interaction with students. It drives my passion for this community that I care so deeply about. My global experience, or global learning experience, can be improved. It's not static. It's not one and done. It's a lifelong learning. And I know that what we've done today, what I'm doing today, will influence and impact the learning, my learning and learning of my students and members of my community, imbibing in them a sense of responsibility, a sense of pride, and a sense of competency to do the work, the global work that's ahead of all of us. So my global learning experience is something that I take great pride in, but also lots of humility in the weight, in the need for shared governance, in the need for collaboration, because nobody can do it by themselves. We all need each other in this work. And I hope that my global experience will be a call, sort of a hand reaching out to say, come join me as we take this walk together.